with everything that's going on with this pandemic, the same questions keep on coming up when I explain my thoughts on what's going on. So I wanted to break down some of the kind of obvious answers that I might give to them. And one of the questions is if populations all around the world and different countries and different governments are giving the same advice in this kind of coordinated way, there's no room for collusion because every country is seeing the same thing. And the reason people say that is because they don't really have an understanding about how different mechanisms in different parts of all across the world globally work. And one of the most important things to realize is that now, in relation to our mainstream media, so the biggest media channels we have in different news stations, different television stations, different newspapers, the majority of all of those, apart from anything independent, they're owned by just 5 massive global entities. And I would suggest that anybody have a look at that. Just put in the 5 main owners of all the media around the world. And what that means is that decisions made when populations are getting information, there can be collusion. So if you've got, one entity who controls a good portion of the media in 20, 30, 40 different countries, absolutely a very biased narrative can come out about what's going on. And the people who own these massive, massive media companies around the world, they are the same groups that actually own the medical industry. And while there's a load of good stuff happening with the medical industry, like trauma treatment and, I guess what nurses and doctors and health professionals do around the world to keep people alive, that information is, I guess, corrupted is actually not an unfair word, because the people who control and run the narratives coming through universities and how doctors and nurses and health professionals get their education and their information, these are the same groups that actually are responsible for the information we're getting through the media. So where am I going with all that? If we look at all-cause mortality, and I talk a lot about this, all-cause mortality, there are less people dying in 2020 than in previous years. And statistics are always manipulated for whatever agenda, whether it's to increase profits, whether it's as a form of social control, whether it's to increase the size of one business or one agenda or one narrative or the other. And I think there is a huge danger in having almost these duopolies, or not quite monopolies, but these just singular entities having this massive amount of control over what happens in everybody's lives. And again, people have this misunderstanding that governments relate what they're telling people, that's coming just from a singular government in one country. And they don't realize that these huge multinational organizations, they don't have borders. The one theme, the one form of information spreads to many different countries depending on where either one organization or the other has its the majority of its power coming from. And again, we look at the whole situation around masks. We've got 40, 50 years of very solid science that tells us that masks are absolutely useless, yet we have governments mandating the use of masks when we know that the leaders in science and in research And the so-called health experts, these guys have access to this information, and there's not one solid peer-reviewed study that shows the efficiency or the effectiveness of masks in relation to stopping the spread of any type of virus. In fact, it's quite the opposite. We've got some, as I said before, some very compelling studies showing that it's actually quite the opposite. You end up with this petri dish in your face where bacteria sit and they multiply, and you end up breathing this stuff back. The spaces in the mask, I mean, I think the size of an average viral particle is something like 0.04 nanometers or something like that from memory, and the holes in fabric masks are 20, 30, 40, 50 times bigger than that. Even the holes around your face, where the spaces between your face and the mask are absolutely massive. And we have studies to show that masks not only are hopeless at preventing the spread of virus, but there's a couple of different studies done in hospital settings that show that masks look like they increase the spread of virus. So we have to ask that question, how come masses of the population are getting delivered information that is just anti-health? Another good one is this whole idea of staying indoors to protect everybody. It's incredibly anti-health, and I could easily make an argument, as could people who are a lot cleverer and a lot brighter than me, make the argument that this direction to stay indoors and not mingle with people will cause far more harm than so-called preventing the spread of some virus. And I'll open that up for you a little bit. One of the most important components for every single area of health is vitamin D. It's actually considered its own hormone. It is extremely powerful, and it's responsible for making all our neurotransmitters. It's got a massive hand in how our immune system works. And vitamin D, the best source of vitamin D, comes from the sun. And I'll link a couple of things up in a second. But another thing that is exceptionally important for our health is cholesterol. Our bodies are more or less made of cholesterol. The solid matter in our brain, apart from the water, about 75% of that, or to 80% depending on what you read, is cholesterol. Cholesterol is incredibly important. And our skin holds lots of cholesterol. So what happens is when we get outside, the sun and the radiation from the sun hits the cholesterol in our skin. That breaks down, and one of the things that's released from that cholesterol is vitamin D. And then that vitamin D is used for just about every process in our bodies. So if we are staying inside, and if we are not being healthy and getting outdoors, our immune systems are compromised. And when our immune systems are compromised, we are increasing our own risks for picking up things that make us unwell. And then when we have family members or older people who are more vulnerable, we simply are unwell, and we are going to pass on sickness to those people who we're meant to be protecting. So this staying inside is just anti-health. There's no logic to it. All our science tells us that it doesn't work. There's in fact no peer review articles that I can find anywhere to show evidence that actually staying inside and isolating prevents the spread of anything whatsoever. And we have historically a good bit of information from what we were calling the Spanish flu and some other pandemics over the years that show that that staying indoors and isolating was absolutely useless. So the powers that be, the government ministers, the health ministers, all these people, these guys are not stupid. They have very, I guess, solid or long lengths of qualifications. So for me to think that these guys are not aware of these studies and the history behind a lot of this stuff it doesn't add up. It's not accurate in any way. So these guys know what is correct health information and what is incorrect health information. And if we then think that they are giving us incorrect information, we have to wonder what the motive behind that is. So there's the objectivity, and the objectivity is looking at what we see happening. So for example, it's daylight today. That's objective. the subjectivity would be, do I like whether it's daylight or not? I think the daylight is good or bad. That's subjectivity. This is my spin at it. So objectively, I feel that the people who are giving us our health advice, they know this stuff. That there's no way to my thinking that they cannot be aware of this stuff, and they cannot be aware that they cannot be not aware that the information they're giving us is bad advice. So then subjectively, I've got to think why that is the case. And in order to make the best assumption I can make, I have to look around and explore other areas to try and work out what's going on. If we look at the history of medicine, and if we also look at the history of the banking system, believe it or not, these things relate to the information we're getting about health. So back to these big kind of controlling entities, these guys have massive hands in our financial system. They have massive control of our educational system. And there seems to be this kind of one theme where everything joins up nicely if we look at those three domains together: the domain of health, the domain of finance, and the domain of communication. And people think that the area of health is kind of just, I guess, some kind of altruistic and pro-human type of thing that is everywhere. In actual fact, that's actually not quite correct. The area of health especially is a business, it's an industry, and every kind of industry puts profits before health and wellness. This is just a fact. These guys have investors, they've got shareholders, and the bottom line is making more money. The other thing which is very, very important to know is the relevance of patents. And when things are under patent, or have a patent, should I say, they, unless that patent is open, then other industries can, if that patent expires, then other industries can come along and make that product for a much cheaper price. And this is incredibly important when it comes to different sorts of medications. Some of the biggest medical companies that we have in the world are notorious for having a very, very successful drug. Antidepressants are a great example. And when the patents expire on those drugs, they manipulate one molecule or one tiny ingredient, and they promote this change of medication as the best and newest and biggest and most important medication, and then they go on a huge selling campaign to sell this new drug, which is under a license and can't be replicated until it expires in 2, 3, or 4 years. So this, again, all kind of ties in. So when we're looking at things like immunity and improving our health, something like vitamin D is not under any sort of patent. Any big medical company can make this, and it is very, very, very cheap. We talked about another malaria treatment, which looks like it's got a lot of effectiveness in treating diseases and viruses. And there's another narrative that's kind of goes along the lines of this malaria treatment treats COVID, and even that is a little bit misleading. It's not the fact that this thing treats a virus or a specific pandemic. It's more the fact that this malaria medication, along with zinc, facilitates the transfer of oxygen in relation to just about any respiratory condition. So if we are labeling conditions as let's say COVID, then those people can get better. But it's not the fact that it directly helps and fixes that, it's the fact that it just has a very powerful kind of stimulating effect in relation to oxygen transfer in our bodies. So we've got lots of misinformation that we got to kind of sort through to make sense of what's going on. And that particular malaria treatment, again, it's another one that's been around since the mid-1900s, so 1950s, 60s and 70s, and it is out of the license on that has expired, so it's incredibly cheap to make. Whereas on the other hand, if we have some injections that are being talked a lot about now, and different sorts of treatments, these treatments they have a license on them, and they can only be made by specific companies, and these companies are charging absolute fortunes for dishing these treatments out. What I think is also quite incredible is the fact that just about every country entered into huge billion-dollar contracts with these drug companies before these treatments were actually considered safe or even effective. So again, we think about why would that be, and if we're thinking that these governments are doing the right thing to kind of help us out and save us from some pandemic, then things don't make sense. But if we think that the same people who are running these governments have got very firm ties to the people who are making these products, you could assume, and I am making this assumption, and I'm saying this quite directly, that the same people are involved in both governments and in these big medical industries, and these are done deals in order to take our tax-paying money and to make those companies richer, and essentially to make us poorer by selling us an untested and an untried product. So with these kind of series of talks, I'm going to be, I guess, kind of prompting people to have a little bit more skepticism about the narrative they're hearing through the mainstream media, and also to have a little bit more skepticism about what so-called experts are telling us. And I'm certainly not putting myself out as a leading expert in this, but what I do know how to do is I do know how to read research, and I do know how to critique that research, and I also know how to follow other great experts in the fields that I'm talking about and compare the information that they're giving compared to the information that I'm hearing on mainstream media. And when you look at both sides of an argument, then things start to make a lot more sense. What I find is the people who are very militant about and who are getting angry about people calling into question this whole pandemic are only listening to one side of an argument, and it's a very polarized opinion, and I keep on hearing the same comments over and over again, which if we dig down and look behind them, there's very little substance behind those comments. So for example, I know somebody who died of, or, well, the reason that all-cause mortality is down is because people are staying indoors, and these comments which are made by people who really don't have a good idea of how the health industry works and how the global system works in relation to how all these little parts join up together. So the message is very simple. Don't trust the majority of what the media is putting out. In fact, one of my best pieces of advice would be for people, if they have a television, to actually get rid of it. It took me a little while to do that. I ended up first of all taking the television from my living area and then putting it in a back room, and then when I realized that I actually didn't really need it or wasn't looking at it a lot, I ended up selling my television. And that was a few years ago now, and it was probably one of the most productive things that I've ever done. And it also was very liberating, because it meant that I wasn't getting that very biased and inaccurate information, which now I can kind of look at with a fresh set of eyes and see right through these absolutely flawed and broken narratives. So if you want to take control of your health, and if you are very passionate about helping the health of others around you, you have to be looking at all sides of the argument and making health decisions which are in the best interests of your own health, because that will have a knock-on effect to your family and those around you. And staying indoors and isolating and wearing masks is actually quite the opposite. You have to also look at why there is not massive loads of information being put out by the mainstream media about how to get on top of your health and your immunity by eating properly, by ditching processed foods, by looking at your alcohol consumption, by getting out in the sunlight, by improving your vitamin D. We're not just hearing this, we're just hearing that this jab that we're going to be getting is our only savior. And statistically, the figures just do not bear that out in any way. In fact, with this jab, if you look outside the mainstream media, you'll find that there are a ton of people getting adversely affected, not only just dying, and relatively healthy people dying, but getting things like facial paralysis, nerve damage up and down their spines, and things like convulsions, and again, I think that message is that through the mainstream media, things are not all they appear to be. In fact, it's quite the opposite. So feel free to send me a message, and I'm more than happy to elaborate with more science on just about anything I talk about. And if there are holes or if there's spaces or gaps in what I'm talking about, then I'll be the first person to put my hand up and say, hey, listen, I was wrong, and I'll modify my thinking on that. So everybody be safe out there. Subscribe to the channel. As I said, send me messages, and I'll put out another video fairly soon about some more of my thoughts on this.